I'm Von Biggs, and let's queer up healthcare. New national survey warns LGBTQ plus health is threatened. South Florida hit especially hard. Tonight, we turn our attention to a powerful new report from the National Coalition for LGBTQ Health that raises urgent concerns for the community. The 2025 State of LGBTQ Health National Survey, completed by more than 700 healthcare professionals, describes a system many providers now call threatened, with others labeling it uncertain and scary. The findings are stark. Fear of stigma and institutional distrust is keeping LGBTQ plus people from seeking care. Gender-affirming care is under attack, with 92% of the providers fearing cuts to Medicare and Medicaid will reduce access. A growing mental health crisis shows rising depression, anxiety, and suicidal ideation. At the same time, nearly half of queer healthcare workers considered leaving their jobs in the past few months. Here in South Florida, the impact is even more severe. 50% of the respondents cited insurance barriers, compared to 28% in California, putting Medicaid-dependent communities at higher risk of losing hormone therapy, mental health services, and HIV care. As we face these challenges, one thing is clear: LGBTQ plus health is not a niche issue, it's a community issue. And in South Florida, where diversity is our strength, we must ensure that every person, regardless of identity, has access to safe, affirming, and affordable care. For more information, visit healthlgbtq.org and stay tuned to Queer News Tonight as we continue to spotlight the stories that matter most to our community. You know, this is a big report. I've read through the whole thing.
You read the whole thing?
I did. I'm one of those.
You're a nerd.
I love that. Yeah, I am. I know. Mm-hmm. But it is scary. It highlights the things that we've been saying all along about stigma and all that. And we've always looked at how, since someone took office, how DEI got removed. And now we're starting to see where everybody's rolling back on LGBTQ healthcare. Yeah. And it's really sad to see, because we see that, and then when we're talking about HIV, you know, we're hearing now with all the cuts that's happening. I just got word today that there's a major cut coming from Florida that's going to affect nearly, at least in Broward County, 9,000 of our people living with HIV. It's going to affect their health care. Wow. So there's more to come on that one. But this just continues to show that we have got to keep standing up, speaking up. And as I tell people, if your provider is not helping you, your provider isn't giving you what you need, find another one.
There's so many providers out there, and there is insurance for you folks. Yes. Okay, look for it, do your research. They want you to not take care of yourself. Right. They want you to not go get these life-affirming meds. Right. I mean, this is not even just like a who you choose. This is life or death, Vaughn.
Right, exactly.
And folks that have been using these meds for years and years, all of a sudden are going to get something in the mail saying, hey, by the way, we had a cut. Right. And it's going to cut your meds.
I mean, Florida, you know, we were cut with, you know, the country was cut with Medicare and Medicaid, you know, but Florida never expanded that. So we didn't lose as much as some states have lost billions of dollars for healthcare because of those cuts. So, yeah, I mean, Florida is better off in that case, but we're going to see this trickle down for quite a while until something is done. You know, healthcare costs continue to rise. Insurance companies continue to put pressure on organizations like hospitals and medical clinics to negotiate rates, to decrease them, keep cutting them down for what they're reimbursing for rates. I was actually at Alibis recently, and I was talking to two gentlemen who were mental therapists, and they were here from Oklahoma City, just here on vacation, but they both have their own practice in Oklahoma City. And I was saying, you know, we could use, and they were black men, and I was like, we could use some black therapists here in Florida, of course, for sure, especially for LGBTQ. And they said the difference is I can get reimbursed 3 times as much in Oklahoma City than I can in Florida for mental therapy. And it's just like,
my God, I mean, come on. These providers are not going to do their jobs when they're getting paid $25 to sit with somebody. They're just not.
No.
It's true. Yeah. It's really scary from the trans perspective as well. You know, from my own experience and from speaking to other trans and non-binary individuals, there's always been discrimination, stigma, a lot of obstacles that stand in the way of actually getting the care, the best care that we all deserve. Yeah. And all of the stigma and then these services being taken away from us, especially with HIV, with regards to HIV, there's a very high percentage of trans women that are living with HIV. I believe it was 42%.
That's astonishing.
In the U.S. in 2020. Yeah, I mean, there are a lot of trans women that are on retroviral therapies, so that is one of the good things, but we want to keep it that way.
Yeah.
And there's been so much work in the HIV population at large with all demographics to really like get people in systems of care, make sure there's medication adherence. This sort of thing is going to really kind of bring that to a screeching halt, and we're going to be going backwards. We already are, and the numbers are going to reflect it, and we're going to go more back into the darker ages, and it's really scary and unnecessary.
Right.
Unnecessary, and the stigma is ridiculous. You know?
We're so close to viral suppression.
Yeah.
But yet this is potentially, the fear is potentially this is going to set us back.
It will.
Wow.
Yep.
You know, folks, you know, and LGBTQ plus folks at home, find the place that represents LGBTQ plus folks, okay? You know, if wherever it is that you're getting your care, make sure that they know that they have not eliminated their LGBTQ part of their page or whatever it is. A lot of people did that in the middle of the night without letting anybody know, you know? And those are the first people that are not going to come to your rescue or help you with the affirming care that you deserve, that you're used to. Again, that you deserve as an American, okay?
Right.
Because we forget about that, you know? I mean, because it's like we're marginalized so much that it's, oh, I don't deserve the care. You deserve the care.
You just go for it. You just get the scraps that you're given in order to survive. And we all deserve to flourish, and we all deserve to have the best health care, just like everybody else.
Right. Amen. Amen. Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.